Areas that have been controversial regarding the use of steroids over the course of time in the emergency room would include things like head trauma, and at this point it's fairly well recognized in the human world for certain, and in our side I think as well, that steroids are not indicated for the treatment of head trauma or traumatic brain injury. There was a landmark study about 15 years ago that showed that steroids given to human beings with traumatic brain injury led to higher mortality rate, and that bore out even over the course of 6 months. Even at the point of 6 months after the injury, they were still more likely to have died than if they had not received steroids and instead have received placebo. So steroids are not indicated for head trauma the way we used to think that they might be. Use of steroids for spinal trauma is not as well known or understood. On the human side, there's still debate about this as well. There were some trials in the late 90s and early 2000s that suggested that the use of a short course, relatively short course, of high-dose methylprednisolone after spinal cord trauma in people led to a very, very modest, but for a human being, important improvement in symptoms over time, such that a human being that received steroids, the short high-dose methylpred protocol, would be more likely to barely move a finger, which might help you steer a wheelchair or type on a keyboard, and have better sensation to a pinprick compared to people who did not receive steroids. And that has led, in the human world, them to think almost certainly steroids have a role in the treatment of spinal trauma in people. Although, to be honest, there are still editorials and debates about that, even despite those findings. So I do not think that steroids are universally used even in human spinal cord trauma. And in the study that was done, they had to be given within a very short time of the trauma, like within 8 hours. And so when we try to apply that information to dogs, for instance, small breed dogs with intervertebral disc disease, it becomes very complicated because they very rarely have a set known exactly when the trauma happened and can we hit the 8-hour window. We as a veterinary community in investigating these cases have been unable to show treatment benefit that's convincing using steroids for dogs with intervertebral disc disease. At the same time, we have been able to show a lot of associated complications with steroid use in dogs with intervertebral disc disease. Most veterinary neurology specialists who I have worked with and know and read their literature do not support the use of steroid medications and treatment of dogs with IVDD, whether they're going to surgery or being treated medically. Either way, most neurologists that I know and whose literature I read do not give steroids to those dogs, although certainly there are some people who still do. So I think the jury's still out on that one. As far as other uses of steroids, we in the emergency room used to think that steroids should be given in hypovolemia, in run-of-the-mill sepsis, in hemorrhagic shock, in trauma, just general trauma. None of those causes, none of those situations have actually borne out to be an appropriate use of steroids. So also CPR, they are not recommended in CPR for either people or animals. The Recover guidelines published in 2012 do not support their use then. So at this time, when we know we should be giving steroids in the emergency room, basically are for hematopoietic neoplasms, immune-mediated diseases, hypercalcemia, insulinoma, and sterile inflammatory disease processes. And there's not much else we know of for sure that we should be using steroids for at this time.